Hello, welcome to Health Alert. I'm Pam Butler. Today we're going to talk about a fascinating program and also some health conditions affecting us disproportionately in our communities. Joining me to kick this off is Dr. Art Williams. He's a clinical psychotherapist with Trinity Rehabilitation Group.
I got it.
Good
morning, Pam.
Good morning to you.
Good.
I am
It's a pleasure
fine.
to be here with you again.
I'm excited to have you.
Good.
Now, we're going to talk about this exciting program you have called CORF. CORF, C-O-R-F, which stands for?
Comprehensive Outpatient Rehab Facility.
Okay, now tell me exactly what it is and why is there a need?
Okay, maybe about 20 years ago, Congress looked at the inordinate amount of people, Pam, going in for medical care into hospital environments. And they felt like a CORF program where people could be treated externally from a hospital in a community would be better for them and also get comprehensive services.
Okay. Now that would be a great idea because the cost overall would be lower than being in an inpatient kind of facility.
Yes, and what we have developed is that we're looking at kind of a holistic perspective in terms of our program where you get vestibular services, outpatient services in terms of physical therapy, mental health services, acupuncture service. So it's kind of like one-stop shopping. We're very concerned about people getting their needs met, and we found so many people. They looked at issues in terms of about 90,000 people, and then maybe a third of people 65 and over have issues in terms of physical therapy and issues like that. So we're looking at developing kind of a holistic framework where people can go in there and get multiplicity of services and care.
Which is a good thing because medicine and healthcare used to consider us sort of as segmented parts instead of realizing we're a whole and that you have to treat each area so the whole can function. So that's what this helps do.
Yeah, and what we found out basically, many people let things exacerbate in terms of healthcare, and so we can deal with the mental, physical, and the spiritual pieces of people, and it's doing really, really well right now.
Now, in terms of the need for that, is there a disparity in communities in terms of accessing these kinds of services by our cultural background or ethnicity?
And I think if we look at the background, specifically for African American people, we wait a little long time. We don't do we do a lot of post stuff. And so what we're finding out is people, when they can come one place versus going to 4 or 5 specialists. And then we also finding a lot of physicians say, well, you got physical therapy, you got acupuncture, you got vestibular issues, you got pulmonary issues. We can refer people over. So we're getting a lot of referrals from other physicians because it's one-stop shopping.
Okay. And then within our communities, do you find that these kind of services tend to be available in one population versus in another, or is it pretty much evenly accessible to across the board?
It's not accessible across the board.
Talk about that.
The disparity in terms of health care. We're looking futuristic, Pam, of putting a satellite clinic north. We've had a dialogue with Dr. Stripling, Dr. Thompson, and Dr. Wade in terms of bringing a program there, and they're very high on that program in terms of one-stop shopping. But we're finding so many people do not get physical therapy care at all. All the aches and pains and accidents and other stuff like that. Also, we're dealing with a lot of issues in terms of pain management, fibromyalgia. We're also dealing with this chronic health problem. Many of the people we get historically have not maybe been satisfied or had issues in terms of what they were getting in terms of medical care, and they come from it. We get a lot of people in pretty tough conditions medically, physically, and mentally.
Now are some of the reasons that happens, is it due to sort of barriers of transportation? Is it due to the fact that people sort of value the health of one population over another a little bit differently?
I think it's all those variables issues together. I think transportation is an issue, even though we provide transportation. I think also there's a disparity in terms of understanding some of the culture. Many people like to come to people who look like them. So I think a lot of it is cultural sensitivity and insensitivity. As we know, and specifically in Tulsa, there's a disproportionate issue in terms of the life expectancy of African Americans north versus south. And that's an issue we want to address too, futuristic-wise, in terms of a satellite going north.
Now with this particular program that you have, even when you do sort of put a satellite in place, do people have to have insurance? Because that becomes another sometimes barrier or thing that people have. Or if they don't have that, do you assist them with signing up for SoonerCare or Medicare services or what?
It's really, CORF is really, Doc, comprehensive Medicare program for Medicare. Now, there is a partial co-payment in certain issues. We also have numerous patients signing up in terms of SoonerCare as well as a private insurance care. But we will work with people in relation with that. Our main objective and perspective is to help in the wellness process in terms of our patients.
Okay. Now, what can people expect coming into this kind of program? Because you're calling it a rehabilitation type program.
Initial assessment in terms of their present physical condition, lab work. We have a in-house lab. See, one of the things we have so many components in-house, so we don't have to refer people out. So they will come and get a total workup, a physical workup, blood work, laboratory tests, and they all have to have a cursory mental health evaluation and system. That's kind of where I come in and do the mental health process like that. So they have the whole comprehensive piece one place.
Okay, and I think that's important to clarify because within the name of the program it talks about rehabilitation. And sometimes people will say, well, I'm not into rehab, I don't need to go to rehab, I don't have a drug problem.
Well, we got to differentiate.
It's more than that.
Rehab in terms of accidents, falls, Medicare Part B in terms of people 65 and over falls, fibromyalgia, pains, aches, breaks. We also do motor vehicle accident type of situation. Also, one of the things we're doing, I think, is very advantageous to people, acupuncture. We have an acupuncture, a doctor from Japan who offers acupuncture. So we have a variety of things that kind of more not traditional, but more contemporary stuff. And I think sometimes we focus too much on the old medical model, give them medication.
Right.
We have a gym where we do exercise, we hold exercises and physical therapy, we have weight training, all these things together in one place.
And that's why I think it's really important that people not focus on just rehabilitation. Thinking our traditional
concept
mind. Right, it is a lot more than that.
Yes, a lot more of that.
Now, age-wise, because you talked about Medicare, what is the sort of the youngest or your age range population that you're working with or who can access you?
It varies. Usually Medicare is usually 62 and on up, but we have a lot of people who have had tremendous accidents and health problems, so they also qualify under Medicare, but they're not 62, they're younger. So it depends in terms of what happened to them, the illness, in terms of what they're dealing with in terms of medical issues.
Okay, and what I'm going to do is tell people right now that at the end of the show I'm going to put up information of how they can contact you, because even if they're not within Oklahoma or within Tulsa, they're somewhere else watching this, they can still contact you for ideas or how to look in their communities to get something like this started.
What we're finding out, CORF programs are like dinosaurs. I mean, there's not a lot of them, okay? And I think maybe one or more in this area in the state, so we're trying to connect with people in terms of understanding this type of medicine is available to them, and we can be advantageous to them in the long run in relationship to their overall health care and wellness.
Exactly, and how to get that in their communities.
In that community.
Thank you so much, Dr. Art, and I want to tell our viewers to please stay with us, because when we come back, we're going to talk to Dr. Block, who's one of your medical care providers in this program.
Okay, thank you for having me.
All right.
Thank you.
Please stay put. We'll be right back.
Clean kitchen surfaces, utensils, and hands with soapy water. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
Welcome back. To continue our discussion, now we're going to focus on looking at integrative medicine, and joining me is Dr. J.E. Block. He's with Integrative Medicine. Welcome to the show.
Nice to be here, Pam.
Now, we're going to start by focusing on what is integrative medicine, because that's the name of your group or company, and you're in private practice.
I am in private practice.
But what is integrative medicine?
Integrative medicine, I am an MD, board certified in internal medicine, urgent care. I used to practice mainly cardiology, but then a decade or so ago, I got a PhD in integrative medicine. This is holistic medicine that takes the best of what we call allopathic school, or what most doctors practice, along with herbal medicine, homeopathy, vibrational medicine, Eastern medicine. You mentioned before in the previous segment that we do acupuncture, and we put it all together, and is now referred to as integrative medicine.
Okay, so it's a way to, as we mentioned in our first segment with Dr. Williams, looking holistically at an individual instead
Indeed.
of compartmental parts and segments, but looking at the whole person.
The whole person.
To make you at your optimal level of functioning.
And the whole look of what, quote, medicine is in 2012.
Okay.
It is a combination of what we do in allopathic, like surgery, give drugs, and also herbs and so on. Now, if one has prostate problems, if saw palmetto works as well as a drug called Proscar, Finasteride, or Avodart, costs less side effects, let's go that way. On the other hand, if somebody has a major medical crisis, an appendectomy, a fracture, no way that herbs are going to be used. They may help adjunctively, but they need straight medicine, emergency room, hospital, and all that entails.
Okay, and that's a good concept in terms of integrative medicine. Sometimes people think, well, if I do that, they're just going to give me a bunch of herbs and stuff, and nothing's going to work, and I'm just going to get sicker. They're going to be taking my money. But like you said, you really are evaluating which sort of approach is going to be the
That's
best
right.
based on the condition, based on where you are in that condition, whether it's stage 2, stage 3, or whatever it is. You're really evaluating that all along the way.
And in our clinic, for example, I believe in chiropractors, and we have nutritionists, as well as doctors in sports medicine, as well as doctors in rehabilitation, pulmonary disease, all there under one roof.
Now tell me this then, because some people may wonder, if you have all of this under one roof, which is a fascinating, excellent concept, do you ever do referrals out?
Yes, indeed. Medicine is so broad. Of course, we don't do surgery. Of course, we don't deliver babies. But there are needs for other super specialists. Gastroenterology we do not have, and people need colonoscopies. They need upper endoscopies, and we do refer them out. Somebody has a bone problem, of course, they need to see an orthopod. So we handle what we handle. We know what we know. We also know what we don't know, and certainly when use an herb where it doesn't need to be given, or deprive somebody from seeing a doctor of another specialty that they really need to see.
Okay, now another question then. It sounds like people may wonder, are you like a primary care type facility or doctor, or is it where the individual still has their own primary care, but then comes into your facility for these additional kinds of holistic viewpoints, and you communicate back and forth with their primary care?
Both.
How does it work?
Both.
Okay.
We do have 5 clinicians, and some of them have primary care where they're seen frequently or as infrequently as the individual needs. We also have people that are referred by other doctors. We see them once or twice, hopefully make a diagnosis or get them on a path of good health. Me personally, I like to see patients that other doctors refer because they have an unusual disease, they're not used to that disease, or they have a common disease that's not being adequately treated or does not respond to the conventional ways of treating a person. Medicine, allopathic medicine, does a great job with many diseases, but a poor job with degenerative diseases, arthritis, atherosclerosis, Alzheimer's disease, and we pick up the slack on those diseases that are very, very poorly treated by conventional medicine. Okay,
now then when we look at integrative medicine and kind of look at healthcare disparities within communities by ethnic group, culturally speaking, how do you view that? What in your opinion, how does that look? Are we pretty equitable? Like you said, it's 2012 here.
I would, the patients that we get that are, the pendulum is swinging towards integrative medicine. A patient would rather have the whole orchestra rather than just the woodwinds or just the brass, and this is what they come. With the ethnic difference between blacks and whites, it is much more and has been more accepted with the white population than the black, but they're reading the same things that I read. You are reading, watching on television, the same programs that everybody else watches, and you're getting not caught into the the wash of it, but seeing that there is another side out there. With the advent of Oprah and who brought in Dr. Oz 5 years ago, and what he has brought on to the community, wow, it's for everybody.
Okay, so you find that some of those healthcare disparities that we've seen, maybe because people were unaware of what was available. I know we talked in our first segment about transportation concerns, or maybe the lack of insurance, or making sure they get signed up for what they need as being possible factors to impact that disparity.
And talking about insurance, I, as a medical doctor, do take insurance, Blue Cross Blue Shield, Sooner Care, Medicare, et cetera, and many other integrative doctors or sub types of these, such as those that do acupuncture, or those that do herbs, or those that do homeopathy. It's not covered by insurance, but under my medical license, it is covered.
Okay, okay. And what I want to ask before we go to break is, when we come back, I want to tell our viewers we're going to talk about some specific disease processes and how they affect populations and what they are. But I do want to ask you about the pharmaceutical portion. You talked about this being integrative with all of these wonderful components within them. What about pharmaceutical services? Is that where persons have to go out, or do you provide a certain level within your facility?
We do provide a little bit within. I do specialize on some unusual drugs that have a hard time getting from regular pharmacies. I use compounding pharmacies because this fits hand in glove with what we're doing. Many of these compounds have homeopathic, they have herbal remedies along with the drug itself. But by and large, like most doctors, I write a prescription and they take it to their pharmacy. And as a medical doctor, 70%, 75% what I do is straight medicine. But where straight medicine can help, that's when we bring in acupuncture, that's when we bring in homeopathy, that's when we bring in vibrational medicine.
Okay, well, what we're going to do is take a really quick break and come back and talk about some specific disease complexes that you work with, or conditions. How do you focus on them? What populations do they affect? And what would you do if a person comes in with it?
I look forward to that, Pam.
Stay
Thank
put.
you.
And you stay put. We'll be right back.
Every day, thousands of people suffer from sudden cardiac arrest. Would you know how to help? Or would they be all alone? Learn what to do at heartrescuenow.com.
Cook foods to the right temperature using a food thermometer. 3,000 Americans will die from food poisoning this year. Check your steps at foodsafety.gov.
Welcome back to continue our discussion, talking about the rehabilitation programs available. Joining me for this last segment, again, is Dr. J.E. Block. He is with Integrative Medicine, and he is one of the physicians there and also in private practice. Let's jump in. Now, I wanted to specifically look at some conditions that people may come into you for. And you can tell me sort of how that looks, as far as how does that condition look overall within our country or within the state, however you want to approach it, and then get into what would you do. I'm going to start with stroke, because we hear a lot about impending strokes and people experiencing strokes, and when should they come in, you know, what does that look like? So
Stroke.
Tell us about stroke.
I would much rather be a fire preventer than a firefighter. I'd like to identify someone who's more prone to have a stroke and prevent that from happening than after a stroke. A stroke can be categorized as an acute process or as a chronic process after the stroke, or a prodrome, that is things that have led up to the stroke. A prodrome of a stroke is something we refer to as a TIA, transient ischemic attack. That is, for less than 24 hours, the person has weakness, has problems talking, has numbness on one side, and it's identified that part of the brain is deprived of blood. There are 17 different kinds of stroke. The most common is deprivation of part of the brain of blood due to either a clot or to an embolus, at a small piece of clot broke off from the heart or one of the blood vessels in the neck going to the brain.
Now let me ask this question in terms of the signs and symptoms you gave. So if there was an individual who is speech is starting to slur, having some muscle weakness, or when should that person say, I need to be seen?
Right then and there. There's a golden window of opportunity, 3 to 5 hours. That is, if that person can go to a facility that can recognize that this is an impending stroke, and a person doesn't know whether this is going to be a TIA, a transient ischemic attack, till after that 24 hours, or whether this is going to be a progressive thing to complete, not just slurring, but aphasia where they can't talk, not just weakness, but paralysis, or even death. So in the very, very beginning, just like a heart attack, when one feels or their loved one feels that this individual is having a stroke, that's where they need to call 911, get to the nearest emergency facility, and hopefully that facility will be large enough that if they need to go on from there, that is, they identify that a stroke is occurring, such as doing an MRI or a CAT scan right then and there, and then there are neurologists there that are able to do such things as a clot buster. If one has a clot that's causing the stroke, if it's not due to a bleed, a hemorrhage in the brain, that person could conceivably receive a clot buster, get rid of that clot, and the stroke be averted. But there's only several hours. If one waits 3, 4, 5, 6, 7, 8 hours, it is too late.
Now let me ask this then, in terms of your facility, because of course people are not going to come there if they're in this urgent stage. They need to go to an urgent care facility. So when they come in to see you, they've already had the stroke. They're already experiencing potentially some effects of that, the results of it, whether it's some changes in speech, whether it's changes in mobility. When they come into you, what are you then going to assist them with?
So this is an individual who has had their stroke,
yes,
and they either had a transient ischemic attack and they're as good as new on the outside, but not on the inside, or they had their stroke and there's residual damage.
Right.
If there is residual damage, we work very hard to identify why that person had the stroke. 80% of them are due to hardening the arteries, atherosclerosis, and we do not just a simple cholesterol or the blood pressure or blood sugar, but the other risk factors for clots. For example, some people are hypercoagulable. They have factor S, factor P deficiency. They have Leiden factor 5. They have too many red blood cells. They have too many platelets.
So as a result, they'll blood clot easily.
And then they will have hypercoagulation. And others have narrow blood vessels due to hardening the arteries.
What are you going to do, Doc? Okay, you're doing all these tests. You're figuring out what's wrong, what's causing it. Now what are you going to do? Are you going to get into the medical regimen in terms of drugs that people could expect? Is acupuncture going to help us with some of that?
We're looking at the ashes rather than the fire. So we're going to prevent progression of that stroke. We're going to prevent another stroke. Fully 80% of people that have had one stroke are prone to have another stroke. And if I can really help that person, yes, we're going to do physical therapy and try to rehab that individual and refer them to a core for another physical therapy. But more important is to prevent them from having the other one. And people that have blood vessel problems in their brain, in their carotids, will also have it in their heart. So these people are also prone to have heart attacks.
Okay, so there would be some drug regimen. Of course, the dietitian, nutritionist would work with them because there needs to be a change potentially in eating habits, those types of things.
And the drug regimen, we focus on what caused them to have a stroke.
Right.
If it's due to high blood pressure, which is a tremendous risk factor in stroke, we work on that. We do it naturally if we could, but most times with significant blood pressure, we use medicines, of course. Nothing will work as well as a medicine, although if it's borderline high blood pressure, or if they incorporate this along with a lifestyle change. They talk about diets. I don't believe in diets. I believe in livets, a lifestyle change that will make transformation in that individual's life.
Okay, so a person coming in, like I said, with those type of significant health issues can still expect that full range of services that you mentioned would be available to them, because at some point, Dr. Williams talked about you have a gym, you have weight issues, weight bearing, or working with weights or exercise, things like that.
That as well as working with weight too. We have a weight loss section, and part of the weight loss section in the Live It Rather Than Diet is an exercise. If one doesn't exercise, if one doesn't change their lifestyle, no matter what magic medicines that the doctors have available, they're going to regain their weight, as the 94% of people that went on a significant diet to lose weight and were successful.
Now let me ask this question, especially in relation to stroke, something that can be as catastrophic as that or as minor, because sometimes there can be minor ones, of course. How do you incorporate the families within that support system, within working with them in your facility? Are there classes for them, or how do they know what they need to do to help?
There should be classes, there will be classes, but right now we do it with the individual, their significant other, or that significant other may incorporate children, neighbors, and we bring them in and talk together. In the future, we will have groups that will have that support groups that are already available, and I do refer people to support groups because it's not that misery loves company, but they can gain information, knowledge, and just feel better knowing that there's other people out there with the same problem.
Okay, and I want to mention real quickly, because I'm almost out of time here, this has been on the table, that you have a book called Discover the Doctor Within, and this is, you mentioned when we were off camera, your 4th book?
My 4th book, yes.
Okay, so people can pick this up and get more information?
And the title is, as you know, if there's 2 doctors, there's 3 opinions, but the opinions that really count is yours. It's not the doctor who's going to get in trouble if he prescribes the wrong medicine or not enough of the right medicine. It is the patient. So it's incumbent upon the patient to know as much as he can about the disease and use the doctor only for advice. It should come from the heart and the brain of the patient.
And so we'll make sure that people pick this up. And I want to say real quickly, because I'm out of time here, that this is not a cigarette. I did want to try to mention this, but it's one of the medical protocols and regimens that you have available to you to assist us that may be unusual that we would see.
It is from an e-cigarette. There's absolutely no smoke, water vapor, or glycerin in there, and we put medications in there as well as herbals. In this, there's B12, B6, coenzyme Q10, and oxytocin.
Thank you so much, Doctor. Well, that's our show. For Health Alert, I'm Pam Butler. I'd love to hear your questions, comments, or suggestions for future shows. Please write me at Health Alert USA, P.O. Box 50913, Tulsa, Oklahoma 74150. Or if you're on the email trail, please email me at healthalertusa@gmail.com. And also visit me on YouTube at youtube.com/HealthAlertUSA. And remember, look into your health care, know what you need to do, and this book tells you, be the doctor within and seek out these services. Thank you.